Hello, my name is Raissa Medina Santos. I'm from the Laboratoire de Génomique, Bioinformatique et Chimie Moléculaire from the Conservatoire National des Arts et Métiers at Paris, France. And today I will present our latest result, named Transcriptomic Analysis Uncovering Markers of Chronic Fatigue Syndrome Post-Chikungunya Infection. So a little introduction about our subject. We work with the chikungunya virus, and his vector is the Aedes mosquito. So during 2005 and 6, large epidemics happened in La Réunion Island, where more or less 40% of the population was infected with this virus. After this, there is another important epidemics happening in Italy, in France, and a huge one in the Americas in 2013 and 14. So when a patient is infected with the chikungunya virus, he will start to present symptoms in the acute phase, which is from the 1st to the 21st day of infection. And more or less 80% of the population will present fever, joint pain, muscle pain, rashes, vomiting, nausea, fatigue, and headache. If the patients keep presenting symptoms after the third month of infection, he will be considered a chronic patient. And more or less 50% of those patients will present some of the following symptoms, such as the more common one is the post-chikungunya chronic inflammatory rheumatism, which is very similar to the rheumatoid arthritis. And we have also the chronic fatigue syndrome which is the subject of this presentation. In this chronic fatigue syndrome, the patient can present symptoms such as brain fog, fatigue, flu-like symptoms, exercise intolerance, pain, and sleep problems. The patient will maybe also present symptoms such as musculoskeletal pain, light cerebral disorders, headache, mood disorders, and all those symptoms will be responsible for a deterioration of the health-related quality of the life of the patient. So since we don't understand why there is few patients who will keep presenting symptoms and consider it chronic patients, and also we don't understand very well those symptomatic problems such as the chronic fatigue or the rheumatism and why they are very similar to the other disease but not exactly. We have as our project the ChikGene project, which is a project aims to identify the genes and the biological pathway that drive the evolution toward long-lasting manifestations following chikungunya, since it's the major public health issue. And the specific goal of this work today, so the part I will present, is the comparison of the transcriptome profile of PBMC between chronic fatigue syndrome patients and other chronic patients. And we aim to identify the molecular signatures for the chikungunya symptoms persistence. It's important to say that this is the first omic study ever on long-term symptoms following chikungunya infection after 12 to 15 years after the infection. So when we check a little bit our cohort of patients, for the RNA-seq, we have 219 patients who are eligible, and between them we have no chronic patients, so 86 patients, and chronic patients 133. So starting from now, we will talk only about chronic patients. So in this group of 133 patients, we did a separation between patients who present chronic fatigue syndrome, so 58, versus the other group of patients who are present other types of chronic symptoms, and we have 75 patients in this group. After selection of cohort, we have three group of phases that we use in this methodology. Sorry. The first one is the blood collection and the PBMC isolation from 2018 to 2020. That means 12 to 15 years after the infection. After that, we have the RNA extraction and the sequencing using Illumina HiSeq. And the third phase is the bioinformatic analysis, where we work with the quality control using FastQC and MuteQC, the alignment using a star, the feature counts and for the counting, this dissect2 for the analysis of the genes differentially expressed, and Metascape for the pathway analysis. So now we will see a little bit of results. So here I present a Vulcan plot showing the genes who are differentially expressed between chronic fatigue syndrome patients and other chronic who we say it's not chronic fatigue syndrome patients. And we can see that between the genes, only 3 genes who are significant in these volcanoplots. It's EGR2, EGR1, and FOSB. And we can see that all of those 3 genes are down-expressed, looking to the log2 fold change, that they are down-expressed in the group of chronic fatigue syndrome. When we check a little bit the bibliography of those genes, we can see that EGR1 and EGR2, both of them early growth response genes, are downregulated when related to stress disorders and schizophrenia. And in addition, EGR1 is associated with multiple viral infections, and normally he is upregulated in the chikungunya infection and in the other virus infections. When we check a little bit the bibliography about FOSB, who is a gene who belongs to a group of immediate early genes, we can see that he's also downregulated in the brain of depressed and drug-addicted individuals. In addition, in SARS-CoV-2, the increase of this gene may indicate a delayed response to the viral infection. So when we see the major diseases connected to all of those 3 genes, we can see depression, drug addiction, schizophrenia, and we can maybe think that's not very well connected to our phenotype, but it's not true, because normally chronic fatigue syndrome is often misdiagnostic as depression, so that can well connect with those major diseases on those 3 genes. And individuals with chronic fatigue syndrome are more often had mood and anxiety disorder than other individuals with other diseases such as fibromyalgia and irritable bowel syndrome. So after that, we would like to see what's happening in the group of those genes who are differentially expressed, even if they are not significant. So for that, we did the pathway level analysis. Oh, sorry. Yeah, so we did the pathway level analysis when we compare chronic fatigue syndrome versus no chronic fatigue syndrome. For that, we use Metascape. For that, we use a group of genes from the DSEC2. And in the left, we can see the top level enrichment terms. And in the right, the enrichment analysis using DGenet, which is a database of diseases who can be connected to some group of genes. And when we check a little bit our major top-level enrichment terms, we can see that they are all very connected to immunity. On the other side, the enrichment with DGenet presents a lot of disease very well connected with our phenotype. So we have depression, mood disorder, mental disorder, and even symptoms who are present in the chronic fatigue syndrome, such as headache and durations, so probably problems to sleep. So in this part of the disease, we see that there is a very good connection between our phenotype. But in the part of the top level, we would like to understand more about why we have such important pathways connected to the immunity. So for that, we work with the weight correlation network analysis, it's a technique that will allow us to understand the significance and the direction of the cluster of genes. So with this technique, we can see the direction of the group of genes and if it's downregulated to our phenotype or upregulated to our phenotype, for example. So here, for example, I will show the cluster of 52 genes who are down-expressed in chronic fatigue syndrome. And when we check the pathway level using Metascape from those group of genes, we can see that we have again, a very, very strong pathways connected to the immunity. So we have adaptive immune response, immunoglobulin production, immunoglobulin mediated to immune response. In the other side, for DGenet, we can see the only significant pathway, it's POEM syndrome. So when I look a little bit in the bibliography about this, we can see that studies report alterations on the immunoglobulin number and distribution in patients with chronic fatigue syndrome, with a substantial decreasing of IgG1 and IgG3 levels. So that's maybe the reason that we have a strongly immune connection in the top level enrichment terms connected to the downregulation of the chronic fatigue syndrome. In the other side, POEM syndrome, it's a hair blur disorder that damages body nerves, and it's not very well connected with our phenotype. That's okay, that can happen. But a little information about that can be connected anyway is that the clinical depression, it is a common manifestation of the POEM syndrome. So the conclusions is that Again, is the first transcriptomic study on chronic symptoms following chikungunya virus infection 12 to 15 years after the infection. The downregulation of EGR1, EGR2, and FOSB, known for their roles on mental disorder, underscore the potential genetic connections between long-term chikungunya infection and the mental health, and to our knowledge, the genetic link has not been previously described. So as perspective, we are doing the analysis of the other phenotypes. So we have other symptoms that are interesting to identify and to analyze the transcriptomic about those patients. And we are also doing a genome association study that we plan to correlate with the transcriptomic data after we finish this second part. So I would like to thank you all for your attention. Thank you to my laboratory for the work and our collaboration with the CR2 in the La Réunion. And also, of course, thank you for choosing me to present my results. There is my email if you have any questions, and thank you again.
Thank you. Do you have any questions for Raissa? I have one question for you. I noticed that the time after the infection is very long. It's more than 10 years, 15 years. So why so long?
Yes, actually, sorry, I'm rereading my voice. Actually, we saw that patients with chikungunya, they can present symptoms during all the rest of their lives. And we would like to really separate the patients who are chronic and the patients who are acute. So the group of acute patients that we have after 10 years, they are, I think we can consider them like maybe they never got infected, because 10 years after an acute infection, it's we always, especially in South America, we always have dengue or something, and we can consider that we never had 10 years after. And in the other side, when we have 10 years and where the patients keep having chronic symptoms, we can really see if there is something connected genetically speaking for the disease that we are looking for.